Hello friends, my name is Dr. Santosh Abraham. I'm one of the specialty registrars in Scarborough General Hospital. So I'm working in endocrinology and diabetes, and I've been working here for a year. So this is one of my initial projects in diabetes and endocrine, SCE. This is intended to help trainees as well as aspirants who wish to take the specialty certificate exam in diabetes and endocrinology. I passed the exam in 2019, and I would like to discuss about how I prepared for the exam and how you can have a better score in the exam. I do agree that the exam is at par or above the level of MRCP Part 2, and the complexity of the questions are also similar or more difficult than the Part 2 exam. The advantage that you have in this exam is you have 200 questions, which is split into 2 sessions. Now, regarding the exam had 200 questions, as I've told you, and around 35% of the exam is concerned with diabetes and diabetic emergencies, and the rest is concerned with the remaining endocrinology. Thyroid forms about 18%. Pituitary is 10%, adrenal is 10%, gonads is 10%, and I think parathyroid is around 8%. But this is roughly a guide which is given by the MRCP UK website, and I don't think in the real exam they usually follow this pattern in a very strict way. So you need to be careful when you prepare for the exam. You need to be well prepared for this exam. You definitely need to know the guidelines. You need to be thorough with the guidelines. You need to know why these guidelines have been created and how these are applied to clinical contexts. This is something which is frequently tested in the exam rather than a straight question. Most of the questions, even though clinical ones, even though they are based on clinical scenarios, the choices sometimes are quite confusing. Even if you narrow down to 2 choices, it's certainly difficult to exclude one among the 2. So that leaves us the thought of revising the guidelines and knowing them in the very best way. So this exam not only helps in revising you for endocrine and diabetes, but also it is quite helpful when you see endocrine referrals, endocrinology patients as outpatients, or even endocrine emergencies. And I would also tell you that this exam also helps you in managing patients with diabetic complications, and problems related with diabetes like driving restrictions, DVLA issues, and adjusting insulin, different types of insulin pumps, and so on. You have a lot of resources over the internet. However, I would suggest you to rely on two resources for questions. That's Study PRN and BMJ. And the reference which you need to use is, one is the Oxford Handbook of Clinical Endocrinology, that is without doubt. And the second is the guidelines which you get from the Endocrine Society. So the Endocrine Society has produced various guidelines on adrenals, pituitary, thyroid, bone metabolism, and reproductive medicine. So you need to carefully go through these guidelines, not only the recommendations, but the reason behind these recommendations have to be explored and understood. Because when you understand the reasons behind these recommendations, you can very well apply these to clinical contexts, rather than blindly learning the questions and answers and trying to answer after seeing a similar pattern. Or, in short, you can answer the questions by identifying the patterns, but if you can do that by thinking and applying the guidelines, that will benefit you more. I think this exam is not you shouldn't take this exam merely for the sake of passing an exam, but this is really a milestone in your life which will help you to focus on topics in endocrinology which really are applicable to clinical, which are really applicable in day-to-day clinics as well as in wards. Now, as trainees in the UK, I'm sure that only in the tertiary hospitals you will have journal clubs or teaching sessions or micro-teaching sessions or interesting discussions. Whereas if you are working in a district hospital, you'll be probably asked to do the on-calls as well as the general internal medicine cover. So the amount of endocrinology and diabetes that you tend to learn is quite less. So that's why I wanted to make this video and this channel, so as to give you some idea about how the exam is and to discuss about the guidelines. I believe that when I upload these sessions, it will help you, and at the same time it will help me, because knowledge increases when it is imparted. You're always welcome to give me suggestions. There may be situations where I might go wrong, and you're always welcome to correct me. I would suggest you 3 months preparation time for the minimum. If you can spend more than 3 months, that's good enough. But you need at least 3 months to prepare for this exam. And bear in mind, you need to revise, because repeated revisions helps you to consolidate the knowledge. On the day of the exam, you need to be really relaxed, as you will be quite stressed out during the exam, because this exam needs a lot of thinking. You might see questions which you haven't seen before. Some of these questions are test questions, and you may have to, you may have to face sometimes unfavorable really unfavorable behavior, or what I will say, like sometimes the exam environment may not be comfortable. All I meant to say was that when I was taking an exam, there was a lot of noise from the next room. Even though I complained, it didn't stop. So it's quite difficult to think when you are taking this exam in such a situation. So you can expect that, because all the Pearson VUE centers may not be good enough. So in that situation, if you are not thorough enough with your preparation, you might suffer there. I would like to do some presentations. Firstly, discussing about the guidelines in general, and then if there are any advances, and then I would like to discuss about applied clinical scenarios and questions and how we can tackle them. Some of you may be in the penultimate year of training, and you may know how things are done in your center. It might be quite similar to the way the questions are framed in this exam. So it might be easy for you, but for candidates who haven't had that exposure, especially the international candidates, it's quite important that you go through the Endocrine Society's guidelines, and as well as the guidelines for European Society of Endocrinology. Now, there are 6 topics which I would like to present in addition to diabetes. So, pituitary, thyroid, adrenals, bone and calcium metabolism, reproductive medicine, and diabetic emergencies and complications. So they are different from the diabetes. And this exam is not like other exams. It's not very interesting to learn initially, but if you read the guidelines again and again, you will start to enjoy endocrinology. You can appreciate that the subject is really different from what you have learned in your undergraduate or postgraduate level. Also, you have to read Oxford Handbook of Endocrinology as well. But if you read from cover to cover, that makes no sense. It will be only useful if you see a case or if you see a question and then refer back. So I welcome you to this channel once again, and I hope to see you in the following days with different topics in endocrinology and diabetes. Thanks a lot for your time and watching this video. Bye-bye.